My name is Brett Hawkins, student physical therapist assistant from Jefferson State Community College, and I'm going to be presenting a case study to you guys today on right lateral epicondylitis. My patient is a 48-year-old male who was referred to therapy by his physician for acute right tennis elbow, which is known as lateral epicondylitis. And his occupation is he's an engineer and he's right hand dominant. So he has to use his right hand a lot for writing and things like that. And he is presented to therapy with pain when he does that for greater than 30 minutes. Also, some other subjective symptoms is he is complaining of a dull ache on the outside of his elbow, and his symptoms began about 2 weeks ago. And he complains of pain with his tennis backhand, and the pain exacerbates when he plays tennis, but when he rests his elbow for a few days at a time, the symptoms go away. So that's the dead giveaway for the lateral epicondylitis. Is with the overuse, the symptoms flare up and then they go away with rest. So a couple of objective areas here is he presents with right wrist extension with an MMT which is manual muscle test of a 4 out of 5, and it is painful when he does that, so his symptoms are increasing. So we want to try and address that issue. And he is tender to palpation of the right common extensor origin, which is right here on the elbow. Okay, now this is my patient here. This is Mr. Aaron Jones. How are you doing today, Mr. Jones? Good. All right, what we're going to be doing first is a soft tissue mobilization to the common extensor origin of his forearm, which is right here, and we're going to do some longitudinal techniques going along the muscle fibers of the forearm, okay? So first, what we're going to do is we're going to apply a little cream here. You mind if I touch you, Mr. Jones? Okay. I'm going to apply a little. Okay. I'm going to find that extensor origin here, and you're going to rub across these tendons just like that in a fast motion. And what we're doing here is we're gating the pain via the use of mechanoreceptors, which stimulates A delta and C fibers, and it will almost provide him with immediate pain relief. And due to the constant dull ache on the lateral side of his elbow and the pain with resisted wrist extension, we have chose to do this treatment. That's transverse friction. And you'll want to do this for maybe 1 to 2 minutes. And then we're going to move on to some longitudinal, which you glide straight up his extensors in a good uniform fashion. Just like that. You feeling okay, Mr. Jones? Mm-hmm. Okay. This should feel very good and relieving to the patient during the treatment due to the pain that they're having. Just a good flow technique, just good synchronized motion. And then if you even want to go back and do a little bit more transverse friction, you can do that. And you want to do it pretty quick, just like that. Don't do slow motions. That in a fashion here. Okay? All right, Mr. Jones, we're going to get you cleaned up here. Okay. Now then, what I want to do is talk to you a little bit, just educate you on some things that are going to help you with your symptom exacerbations and acute flare-ups, okay? So what we're going to want to do in the initial phase of rehab is, I know you like to play tennis. Well, for the first few weeks, we're going to need to stay away from tennis play to prevent flare-ups, okay, of symptoms. Because we need that rest to allow the inflammation to go away and the site to heal, because it can become chronic. Okay, so what we want to do is we're going to modify your activities of daily living, which is tennis, and I understand you've been having pain at work from writing longer than 30 minutes at a time. So what we want to do there is maybe get a pen or a pencil and modify the grip by putting a grip extender on it, so you'll have a thicker grip to grab, and that should help alleviate that pain. Okay? And also, with your tennis racket, which we're not going to really be worried about that just yet, but in the coming weeks, you'll be hopefully ready to return to tennis playing. And what we're going to want to do is modify that racket. And we're going to want to do, just like we did with the pen, make the grip wider, larger by racking it, or you can get an extension to put on it to make the grip larger. And we'll also want to use a two-hand backstroke instead of a one-hand. That takes some of that pressure and absorption off those extensor tendons when you touch the tennis ball. Okay? And we'll also want to loosen the strings up to kind of help absorb that force of the ball, and it won't translate into your forearm quite as much. Okay? And also we'll want to use a lighter racket. That'll also take the pressure off those extensor tendons, having to carry that racket around for such a long period of time. Okay? All right. If you got any questions, think you can handle it? Okay. Well, now what we're going to do is we're also going to be putting you on a home exercise program, okay? And I'm going to demonstrate one exercise that you're going to be doing, okay? And what it is it's a hand stretch for your extensor muscles of your forearm, okay? And what we're going to be doing there is we're trying to increase the flexibility of the extensor muscles of your forearm and get you a pain-free range of motion active, okay? Because we want you to return to normal daily activities in a pain-free range of motion, okay? So what we're going to do, I'm going to demo. First, you're going to hold your right arm out, just like this, just below eye level. Take your other hand, gradually pull your hand down till you feel tension, okay? When you feel that point of tension, slowly pull it just a little bit past that first initial tension, okay? Then what we're going to do is we're going to hold it right here for about 10 to 15 seconds, okay? Then what I want you to do is relax, okay? Relax for about 10 seconds. Then we'll pull it back down. Hold for another 10 to 15 seconds, okay? And you want to breathe throughout the activity, okay? Don't hold your breath. All right, and we're going to do this for 3 to 4 sets, twice a day, okay? So if I could have you show me how to do that one good time, okay? Pull down, good. As you can see, he's stretching the extensor muscles of his forearm here for his increased pain-free range of motion, which we're trying to achieve, okay? Keep holding, hold, and relax, good. All right, we'll relax for about 10 seconds. We're going to have him relax for a short period of time, then we're going to do one more set. And when he's at home, he'll do 3 to 4 sets of this twice a day. How you feeling, Mr. Jones? Okay? All right, good deal. All right, let's try one more set. Hold it. Hold it. Hold. Okay, rest. Good. All right. Mr. Jones, thank you for working with me today. That concludes our session. Okay? Thank you. All right. Now, for our patient prognosis, okay? This patient should be able to return to full functional levels of activity after he goes through his initial therapy session and his re-eval. But as of right now, in his initial treatment, he presented to therapy with a painful range of motion. So after we get that worked out and he can progress to resistive exercises and can do them in a pain-free range of motion, then he will be able to start returning to functional activities, which he loves to play tennis. So once we get him to where he can do that backhand and backstroke with a pain-free range of motion, he'll be ready to return to full functional activities. So, and it'll be patient dependent on the time when we can get him to his pain-free range of motion. And so his prognosis is good, and he should be able to return to full functional levels of activity. And that concludes our session. Thank you.